All right, welcome to presentation number 2. We're going to be talking about antidotes briefly, which include naloxone, N-acetylcysteine, and sodium bicarbonate. These are medications that we are likely to encounter when transferring a patient from the ER or the ICU at Georgetown Community Hospital on into Lexington. Fortunately for you, I'm not very good at recording these things. You get a break from my face for the rest of the presentation. So let's talk about naloxone first, also known as Narcan. It functions by displacing the opiate receptor or opiate at the receptor until the opiate itself is eliminated from the body. In IV form, the typical half-life is about 1 hour, but it can be up to 2 hours just depending on the patient's metabolism. And for IM dosing, of course, it would be longer than that, but we're talking about transfer infusions, so about an hour. And Narcan is typically used in an infusion when someone's ingested something very long-acting like methadone. And any issues with the infusion en route, like withdrawal, which would be the most likely complication from a naloxone infusion, can be dealt with by turning off the infusion, turn off the drip, just like almost every other medication that we take in transfer. All right, so next up is N-acetylcysteine, and this is 99% of the time used as an antidote for Tylenol. We used to use it once in a while for mucus expectoration, to kind of break up mucus in kids that had cystic fibrosis. It works by repleting or regenerating glutathione at the liver, and by doing so, it doesn't allow toxic metabolites of Tylenol to form in the first place. It provides complete protection against acetaminophen overdose, no matter of the severity, as long as it started within 8 hours of the ingestion. Now, with the N-acetylcysteine, there can be a fairly large incidence of anaphylactoid reactions. And again, what do? We stop the drip. And anaphylactoid reactions are a little bit different than anaphylactic reactions in that they're not histamine or IgE mediated, but you stop the drip, you infuse volume as needed, and things should get better. But some of the expressions of the reaction, like skin redness, hypotension, tachycardia, nausea, those things can be quite similar. So and actually happen not infrequently with this, but typically would probably happen before we transported a patient. And just remember that for this particular infusion, a patient who's on it is probably suicidal. So if they hop off the stretcher and try to jump out of the moving truck, it is probably not an adverse reaction, but more likely just related to the fact that they are still suicidal. Last medication in this grouping is sodium bicarbonate. It is used for typically 3 different indications. Metabolic acidosis is probably the first thing that jumps to your mind. Things like DKA with a severe acidosis and a pH of about 7.1 or less. We use it to neutralize acid and reestablish really cellular function like it should be, that is cut off when the pH gets so severely acidemic. It's also used to treat hyperkalemia, and it does so by neutralizing the H plus ion, and that allows for potassium to go back into the cell. And there, because we only really care about potassium that's outside of the cell and in the serum, so that treats hyperkalemia. And by that same token, though, if you're using sodium bicarbonate for any of these indications, just be aware that it can cause hypokalemia, which can cause cramping and muscle spasms and stuff like that. It can cause cardiac issues and irritability, but not nearly as much and not as consequentially as hyperkalemia. So the last indication, though, for sodium bicarbonate is a tricyclic overdose. And it can be quite life-saving for that indication. And I've never seen it, but evidently if you push sodium bicarbonate in a patient who's very sick and has a prolonged QRS interval, you can see it correct, like right in front of you. So, and warnings or precautions with sodium bicarbonate infusion are just that it's caustic to the tissues. So make sure that your IV site is secure and that it's not infiltrating. And also be aware that a lot of medications, when given through the same IV or in a line that has had sodium bicarbonate in it, will tend to precipitate. And you all know a lot more about that than I do, so I'm not going to belabor that issue.